Hey guys, I'm Dr. Sebastian Gonzales. I'm going to be one of the presenters at the CalChiro 2019 Sports Symposium over at Dignity Field in Carson. It's October 4th and 5th. I'm going to present on a Friday, by the way, Friday afternoon. Come to that. The topic I'm going to be talking about is one that I don't think is covered very frequently, and it's mainly how to use a loading strategy, a corrective exercise strategy, a resistance training strategy to actually decrease people's symptoms within a session, and I do mean within the same day. I've come to find over about 10 years of practice or so, I think that I was spending a little bit too much time doing passive care, as well as spending a little bit too much time doing manual therapy. And I don't think there's anything wrong with doing those things. Manual therapy and passive care, I think, have a time and place. However, as I started to see and explore the other options out there and loading people fairly aggressively, actually on day one, I found out that lo and behold, it actually decreases their symptoms. It was very startling thing for me to see, honestly. And so what I plan on sharing with you guys at the symposium is I'm going to do a rundown of what's worked really well for me in clinic. Not necessarily saying that things that you do won't necessarily work, but I'm saying these things have worked very well for me to reduce femoral acetabular impingement, or FAI, really without having to do any tissue work. A lot of people will present with groin pain in the front of their hip. Also too, they'll have a positive Faber's, Scour's test, circumduction test, and sometimes groin pain just above the knee. And so I'm going to show you how to reduce these things with a loading strategy, some corrective exercises that are fairly aggressive, but also too very efficient, and getting them into resistance training. So we're going to get these people to decrease their symptoms significantly. I mean, by hopefully like 30% would be great, 75% would be amazing within the same session. I'll also show you guys some dynamic hip testing that you don't often get to see in school. You'll see the standard Scour's, Faber's, circumduction, and so on, but making them dynamic will actually classify some of these patients, in my eyes, about will they respond to a rehab or buttressing or stabilization approach. And so hope you guys join me in that. This is my first time presenting this topic. I think I have a lot of knowledge to share in it because it's worked well for me. It's based upon a lot of concepts from different places. I will share those references as I'm up there as well. So again, Sebastian Gonzales, if you're looking to follow me on Instagram, that's @PerformanceHB. I'm also the host of the Restoring Human Movement podcast on iTunes and Spotify. See you guys soon.